wonderful episode here, Just Podiatry. We have a very pleasant patient who has returned to our office with dun 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 dun. Would you like to say it?
Another ingrown toenail.
Ta-da! Or maybe not so. Ta-da! Okay. So we decided to definitely stage them, right? So the patient was here last week.
About 2 weeks ago.
2 weeks ago we did the right one, and then today we're just gonna go ahead and do the left one. That's what we're doing today. Let's go. So again, just basically just loosen up this little where the nail fall. The wonderful thing about these procedures is that you never know what you're gonna find. Something may look so benign, right? Benign, I mean like in respect to the size, right? And all of a sudden, you just never know what you're gonna find. It's like going fishing. So you really want to get deep all the way back there. And here we go. Bingo. Take my little nipper. This is just, like I said it before, this is just connective tissue. Connective tissue. If anyone is wondering, we continue to get new viewers. If anyone is wondering why don't I use a tourniquet, I never use a tourniquet. Using a tourniquet, one of my mentors always taught me that if you use a tourniquet, you're congesting the toe, so you're holding all of the blood, right? There's no blood to the area, so there's more congestion. The more congestion equals more pain after the procedure. I'm going to repeat this. Using a tourniquet, right, causes more pain after the procedure. Okay, that's why I don't use a tourniquet, because when I was with, learning from my mentor, and I followed some of these patients, he was right. And there is less discomfort because you are not using the tourniquet. You're not holding, using the tourniquet, you're not letting the blood get to the affected, just to the tip of the toes. Okay, this looks wonderful. Now what I'm going to do, just a quick flyby in the back here, make sure that everything is nice and clean. I want to give everyone a really nice look into the nail fold there. Let's see if we can get that really nice. There we go, nice and healthy. And you don't see the tourniquet is not present. It's not a bloody mess. Everything is nice and clean, and the reason being is because in this procedure we're not cutting skin. We're only trimming the nail all the way back. Very important. We are not cutting skin. Only toenail. Toenail, avascular. There's no blood. A beauty. Anyone wondering? There is antibiotic cream there. And voila. How do you feel?
Good. Thank you. Thank you. Thank you.
Great. I feel great as well. I mean, I didn't feel anything, you know that.
I appreciate it.
Absolutely. You know, the wonderful thing about these procedures, and we do a lot of different, in the world of what we do, we have the two extremes. We have limb salvage, which is basically all the patients that come in that we do amputations and this and that, and you know, all of the ulcers and all the kind of like the more complex clinical presentations. And then you have the simple, you know, on the simple side of the spectrum, you know, the ingrown toenails, the calluses, the painful corns, calluses, etc. And it doesn't really matter whether it's over here or over here. Something as simple as a corn, we've spoken about it before, a simple corn is like having a pebble in your shoe, and that can cause a significant amount of pain. The point is that a simple ingrown toenail,
Excruciating pain.
right? So it's really fulfilling to be able to help patients, whether they're over here or over here. And that's a great feeling for a lot of reasons, for both patient and doctor, and foot, of course. That's one of the great parts of, you know, what we do in our profession. It could be something serious or maybe not so serious, but the outcome is the same, right? What we feel here and what we feel here. Like always, www.jawspodiatry.com, Instagram, Dr. Tojan, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. If anyone has any questions, I urge anyone and everyone to please post them on our channel. I will definitely get to everyone.